Let's now talk about REN 12, a front collecting or Mu front point. REN 12, or middle cavity, Zhongwan, is located on the anterior midline, fourth zone superior to the umbilicus, or fourth zone inferior to the sternocostal angle. How to find? The distance between the sternocostal angle and the center of the umbilicus can be divided into 8 zone, which can vary considerably from the patient's fingered zone. Therefore, only proportional zone measurement should be applied here. Helpful device would be the use of an elastic tape. From the center of the umbilicus, measure either fourth zone in a superior direction or from the sternocostal angle fourth zone in an inferior direction. There, locate REN 12 on the anterior midline, or using the spreading hands technique. Place the little fingers on the sternocostal angle and the center of the umbilicus respectively and determine the midpoint. So this is now REN 12. Get the midpoint of this distance by joining the index fingers. Located on the same level are kidney 19, which is 0.5 zone lateral to the midline, and stomach 21, 2 zone lateral to the midline. Needling 0.8 to 1.5 zone vertically or obliquely towards surrounding points. Stomach 21, REN 10, REN 15. Caution: rupture of the peritoneum, pregnancy. If indicated, moxa is recommended. Actions or indications: REN 12 harmonizes and tonifies the middle burner, descends counterflow qi, regulates qi flow and alleviates pain, transforms dampness. Special features: front view point of the stomach, meeting point with the SI, triple burner, and stomach channels, Hui meeting point of the Fu organs, and a major point for functional stomach disorders. REN 12, also known as Zhongwan, is the front view point of the stomach and the Hui meeting point of the Fu. The term Mu means to gather or to collect, and the front view points are where the qi of the Zang-Fu gathers on the anterior surface of the body. As the origin of the post-heaven qi, stomach and spleen are considered to play a central role among the Zang-Fu, transforming and distributing the essence of food and drink throughout the body. For this reason, stomach may be said to dominate the Fu and the spleen the Zang. Close relationship of REN 12 to the stomach, therefore, is further reflected in its status as the Hui meeting point of the Fu, in the same way that liver 13, the front view point of the spleen, is also the Hui meeting point of the Zang. REN 12 is the principal point on the abdomen to regulate function of the stomach. The investigation into points along the channel simply states that REN 12 can treat all diseases of the stomach and spleen. In comparison with neighboring points, such as stomach 21, REN 13, and REN 10, which are predominantly indicated in excess patterns, REN 12 is equally applicable in disorders characterized by either excess or deficiency. Stomach is sea of water and grain, and its principal functions are to receive food and drink, rot and ripen them, and then descend these transformed products. Disorders of the stomach may be deficient or excess in nature due to cold or heat, exterior pathogens, or interior disharmony. Whatever the etiology, disharmony of stomach will always manifest in disturbance of one or more of these functions. If stomach fails to receive food and drink, there will be inability to eat and difficult ingestion. If the stomach fails to rot and ripen and to descend, there will be fullness, distention, and pain. If stomach qi rebels upwards, there will be nausea, vomiting, stomach reflux, and hiccup. TCM methods of health preservation have long recognized the importance of emotional harmony in the smooth functioning of the stomach. The constant dissipation of qi resulting from worry, anxiety, and overthinking may deplete the stomach and spleen and impair function of the stomach. Excess of any of the 7 emotions may result in qi stagnation, which then injures the stomach, leading to epigastric pain. Most injurious of all the emotions are anger, frustration, or resentment, particularly if experienced while eating. At this time, the qi is focused on the stomach, rendering it particularly susceptible to qi stagnation. In all these cases, REN12 is a primary point. In practice, epigastric pain or distension deriving from liver qi stagnation may be accompanied by pain or distension of the lateral costal region. Not only is REN12 indicated for this symptom, but the needling sensation from REN12 commonly transmits to this area. Stomach and spleen are intimately related. According to the treatise on the Spleen and Stomach by Li Tongyuan, when stomach deficiency gives rise to failure of the Tai-yin to receive what is not naturally due it, the Fu-Tiang Ming-Mu point, REN12, will lead it through. This highlights the important secondary action of REN12 in strengthening the spleen in cases of deficiency. It is indicated for diarrhea, undigested food in the stool, deficiency taxation, postpartum dizziness, and sallow complexion. Finally, REN12 is cited in the Song of the Nine Needles for returning the yang for treatment of collapse of yang characterized by loss of consciousness, aversion to cold counterflow of the limbs, and purple lips. Thank you very much for your attention.